Hey guys, so I'm on my way to work as usual, and I thought I would drop a quick video on the CEA exam. So if you're a Chamberlain College of Nursing FNP student and you're going to take the CEA exam, or if you're in another nurse practitioner program and they utilize the CEA exam, or if you're just wondering what the CEA exam is about, then this video is for you. So I just took my CEA exam 2 days ago. It was for Chamberlain College of Nursing NR667 predictor exam for the capstone course, the last course in the FNP program. So Chamberlain will have you go to a 2-day immersion event that goes over what's going to be on the CEA exam, and basically it's a predictor exam of how well you'll do on the FNP exam. So it's a board prep as well. So I took the exam 2 days ago and I scored a 380 out of 400, so I did pretty well. I will tell you, it is not an easy exam, but do not get discouraged. You'll be okay. So if you pay attention during the 2-day intensive review course, you're gonna be okay. Everything that was discussed in that course will be on the exam. Pay close attention. Each detail is important. So I'll go over the different things that will probably be on the exam. Due to the policy of Chamberlain, I will not be discussing exact questions and answers that were on the CEA exam. However, I will speak about what was discussed at the intensive review. So if you get it, you get it. All right, so know your iron, know your binding capacities, know your MCV, know your hemolytic anemias, your microcytic, macrocytic anemias, thalassemia. Know your abdominal conditions and your appendicitis, cholecystitis, pancreatitis. Know your urinary conditions, all of those, and know your antibiotics. Know your gram-positive and gram-negative bacteremias and the antibiotics that treat that bacteremia. And also know your cancers. Know your basal cell, squamous cell, carcinomas, and know your skin conditions. Know your Addison's disease, your Cushing's disease, and know your asthma medications, your SABAs, your LABAs, and your inhaled corticosteroids. Know which medications that you do not want to utilize as monotherapy. Know your cranial nerves. Make sure you know the cranial nerves. And just think of it like this. The exam is not going to harp on one subject. They want to know that you have a safe, general understanding of many disease processes and treatments. If you approach the exam like this, we are providers, we're at the end of our training, and we are going to be practicing and treating the population. They want to make sure that we are safe practitioners, that we're not going to hurt or kill anyone. So you're going to be presented with questions such as a patient presents to primary care and is presenting with these symptoms. Okay, is this going to be a patient that you're going to treat, or is this a patient that's presenting with signs and symptoms that warrant any emergency evaluation, such as referral to emergency department? Okay, patients presenting with these symptoms, how are you going to medically manage them? Are you going to be able to safely prescribe this patient medication? You know, they're not going to expect you to know the exact doses and medications for everything, but you do need to know what you will absolutely not be prescribing medications. For instance, you are not going to be prescribing a LABA, okay, for an asthmatic patient as a monotherapy. Okay, you're not going to want to be doing something like that. That is dangerous practice. You can kill someone. So if you approach the exam with looking at it from that standpoint, you'll be okay. So if you have any questions, go ahead and DM me. I will answer your questions to the best of my ability if I'm able. And if you have any questions as far as Chamberlain's intensive 2-day review in Chicago, I did make a few videos about the Q Center and all the things in my other videos. You can take a look at that. But if you're a Chamberlain University student and you're heading towards the capstone course, Just know that you can do it. Keep your head up. There is light at the end of the tunnel, and you will defeat this. You will complete it. If you're a nurse practitioner student at another institution, light and love to you. Keep going, keep pushing. It's not if you finish, it's when you finish, and you will do it. No matter what comes your way, you will find a way, you will push through, and you will complete this program, okay? Love and light to all of you.